Dr. Aparna, in your beautiful country in India, there are hundreds of Ayurvedic hospitals and thousands of Ayurvedic doctors, but there's also a lot of allopathic hospital in India, and India has produced some of the best allopathic doctors in the world. How does it combine? How do you combine both medicine in India?
So Ayurveda is a living wisdom, and it is incorporated in the religion and culture. So 70% of the people knowingly or unknowingly follow the Ayurvedic principles.
How many?
70% of the people.
70% of 1.3 billion.
Yeah, Ayurveda is not just the medicine side, right? So this is the right living. So they will be like doing the tongue cleaning without even knowing why they are doing it, right? Like when I have seen my friends using a tongue cleaner and they have no idea that it is told in the Ayurvedic textbooks to use a tongue cleaner, or they are doing the oil pulling without knowing that it is an Ayurvedic ritual. So and they use spices in the food, and when they are the digestive fire is it is a little low, then they have the special tea from the kitchen from the herbs. And this is all Ayurvedic principles imbibed in the culture and the religion. And before a certain festival in India, it is very mandatory that all of us undergo a cleanse, a regular cleanse. So, the grandmothers and the grannies, they give the grandchildren some medicine and make them poop to clean there before the festival. So, as I said, it is imbibed in the culture, and it is in the roots. So Ayurveda is very much developed, especially in Kerala. We have a collection of some villages, and we have an Ayurvedic dispensary there. We have a homeopathic dispensary and also an allopathic hospital. So people are given choice on which system you have to choose. So if a dispensary is like an OP unit, you come and then go, and then each district have an Ayurvedic hospital. It will be like 20 to 40 bedded hospital according to the capacity. You can come and get admitted and get treated. And then we have like Ayurvedic medical colleges. So if we are not able to manage it here, we refer to higher centers. So this reference system is very good in Ayurveda. And no science is complete. Every science has its own positives and negatives. So is the Western medicine, like allopathic medicine. So Ayurveda is very futuristic medicine because it is very integrative in approach. It has integrated the principles of yoga, it has integrated the principles of astrology and all the popular sciences which was very popular during that time of period. And as an Ayurvedic doctor, I know what are the diseases which I can manage with my science, and what are the things or what are the diseases which I should refer. So there lies the smartness of a physician or an Ayurvedic doctor, because we know our possibilities and limitations. So I don't think they go opposite. They should actually, Ayurveda and allopathy should go hand in hand, because both of the systems have lacunae. So it should go hand in hand and give the best to the people.
Are the allopathic doctors, what's their view on Ayurveda? Are they the kind of above all of that, or do they, because they are Indians, they understand the principles of the old Vedas, will they encourage people to use Ayurveda as a medicine?
So most of the people, the modernized way of living, we have forgotten our roots. So Ayurveda was looked like a folklore and tribal type kind of medicine, but because in past 20 years there are many good colleges coming up, and we have researches and evidence-based studies and clinical trials which is happening in Ayurveda, and we are publishing papers, and we are registering our trials in the clinical trial registry of India and the platform, the international platform, and Ayurveda is slowly getting recognized. And from my personal experience, I know very good allopathy doctors who treat the patients and they say, okay, this is what we can do, now you can go to an Ayurvedic doctor. And we do vice versa, no? If we have something and okay, now this is not manageable with us, so please go to an allopathic doctor, get it fixed and come back, and then we will do the best in Ayurveda. So there are many doctors who are very understanding and accepting the fact that Ayurveda can heal people, but we unfortunately we also have a group of doctors who are very skeptical about the science. But I think and I hope that the studies and evidence-based clinical trials will be an eye-opener for coming generations.
Yeah, I think it will, and even in the West, we have had some doctors that have done a panchakarma with us, some allopathic doctors, and they were very impressed with the results. So it's very interesting, and it feels also that in the West now more and more the science is marrying the spiritual life, which is beautiful, which is about time that it happens. Thank you very much, Dr. Aparna.
Thank you.